You know that feeling in your stomach before a big presentation? That uneasy sensation that makes you question everything you've prepared for? Or that racing heart when you're about to do something new? Your palms get sweaty and you feel like you can't catch your breath. That's anxiety. And guess what? It's completely normal. You're not alone in this. We all experience it from time to time. It's a universal feeling that connects us all. In fact, anxiety is one of the most common mental health concerns out there. Statistics show that millions of people deal with it every day. Anxiety is your body's natural response to stress. It's a signal that something needs your attention. It's like a built-in alarm system designed to keep you safe. Your body is just trying to protect you. When you sense danger, your brain sends signals to your body, preparing you to either fight the threat or run away. This is known as the fight or flight response. This fight or flight response is helpful in truly dangerous situations. It can save your life, but sometimes this alarm system gets a little too sensitive. It can trigger even when there's no real danger. It can go off even when there's no real danger, leading to feelings of worry, nervousness, or fear that are out of proportion to the situation. This can be confusing and frustrating. These feelings can be mild and temporary, passing quickly once the perceived threat is gone, or they can be more intense and interfere with your daily life. They can make it hard to focus, work, or even enjoy your favorite activities. The good news is that anxiety is treatable. There are many ways to manage it effectively. With the right tools and support, you can learn to manage your anxiety and live a full and meaningful life. Techniques like mindfulness, therapy, and even medication can make a big difference. Remember, help is available and you don't have to face this alone. Imagine your brain has a tiny almond-shaped structure called the amygdala. This little powerhouse is responsible for processing emotions, including fear and anxiety. When you encounter a perceived threat, your amygdala jumps into action, sending signals to release stress hormones like adrenaline and cortisol. These hormones cause the physical symptoms we associate with anxiety, such as a racing heart, rapid breathing, sweating, and muscle tension. They prepare your body to deal with danger, even if that danger is just an upcoming job interview or a first date. While this response is helpful in truly dangerous situations, it can be problematic when it's triggered too easily or too often. This can lead to a pattern of excessive worry, fear, and avoidance that can significantly impact your quality of life. Understanding how anxiety works in your brain is an important first step in learning to manage it. By recognizing the role of the amygdala and the physical symptoms of anxiety, you can start to identify your own personal anxiety triggers and develop coping mechanisms. Anxiety can manifest in different ways, affecting both the mind and body. Some people experience occasional bouts of anxiety, which might be triggered by specific events or situations, while others live with persistent and debilitating anxiety disorders that can interfere with daily life and overall well-being. Let's take a look at some of the most common types of anxiety disorders, which can vary greatly in their symptoms and severity. Panic disorder. Imagine this: you're going about your day when suddenly, out of nowhere, you're hit with an overwhelming wave of terror. Your heart pounds, you can't breathe, and you might even feel like you're going to die. These intense episodes are known as panic attacks. These are the hallmarks of a panic attack, which can be incredibly frightening and disorienting. People with panic disorder experience recurring panic attacks and often live in fear of when the next one will strike, which can lead to avoidance behaviors. Social anxiety disorder. Does the thought of public speaking make your palms sweat? Do you feel a sense of dread at the idea of being the center of attention? Do you avoid social situations because you're afraid of being judged or embarrassed? This fear can be so intense that it affects your ability to function in social settings. If so, you might be dealing with social anxiety disorder, a condition that can make even everyday interactions feel overwhelming. This disorder involves an intense fear of social situations and can make it difficult to interact with others, even in everyday settings like work or school. Phobias. A phobia is an intense and irrational fear of a specific object or situation. This fear can be so strong that it leads to avoidance behaviors. This fear is out of proportion to the actual danger posed by the object or situation, making it difficult for the person to rationalize their fear. Common phobias include spiders, heights, flying, and needles. These fears can significantly impact a person's life, limiting their activities and experiences. People with phobias often go to great lengths to avoid their triggers, which can significantly impact their lives and limit their daily activities. Remember, these are just a few examples of anxiety disorders. There are many other types, each with its own unique set of challenges and symptoms. If you're struggling with anxiety, it's important to talk to a mental health professional to get an accurate diagnosis and develop a treatment plan that's right for you. Treatment can include therapy, medication, lifestyle changes, and support groups, all of which can help manage symptoms and improve quality of life. You might be wondering, why do I experience anxiety so much? It's a question many of us ask ourselves, especially when anxiety seems to strike out of nowhere or persist despite our best efforts to manage it. The truth is, there's no single answer. Anxiety is a multifaceted issue, and understanding it requires looking at various aspects of our lives and biology. Anxiety is a complex condition with a variety of contributing factors. It's not just about feeling nervous. It's a deeper, more intricate experience that involves our mind, body, and environment. Let's explore some of the potential causes, from our genetic makeup to our life experiences and even our personality traits. Genetics. Just like your eye color and height, your predisposition to anxiety can be influenced by your genes. If anxiety runs in your family, you might be more prone to experiencing it yourself. If you have a family history of anxiety or other mental health conditions, you might be more likely to develop anxiety yourself. This genetic link can make you more sensitive to stress and more likely to react with anxiety. Brain chemistry. The chemicals in your brain, known as neurotransmitters, play a crucial role in regulating mood and anxiety. These chemicals help transmit signals between nerve cells and influence how we feel. Imbalances in these chemicals, such as serotonin, dopamine, and norepinephrine, can contribute to anxiety disorders. When these neurotransmitters are out of balance, it can lead to heightened feelings of anxiety and stress. Life events. Stressful or traumatic life events can also trigger anxiety. Our experiences shape us, and difficult times can leave a lasting impact on our mental health. Experiences like childhood trauma, abuse, the death of a loved one, job loss, or a serious illness can all increase your risk of developing an anxiety disorder. These events can create a sense of vulnerability and fear that lingers long after the event has passed. Personality. Some people are simply wired to be more anxious than others. Your personality traits can influence how you respond to stress and uncertainty. If you tend to be a worrier or have a more sensitive temperament, you might be more susceptible to anxiety. Understanding these aspects of yourself can be the first step in managing and overcoming anxiety. If you found this video helpful, please like, share, and subscribe for more content on mental health and well-being.